this on. I hope that's all right. And welcome to the meeting on June the 8th. Let me share screen so that we've got everything in front of us, which I think is this one. So there were a bunch of actions from last time. If we just want to quickly run through those, then that will, I'm sure, bring up everything we need to talk about anyway. So just to start off with the synthesis of the AZ alcohol compound, actually, Yuhang, you put something up here already, so maybe I can just use that. Do you want to just say a couple of things about this really quick?
Yeah, sure. So hello everyone. This month I managed to synthesize, I managed to attach the 5-member core to the pyrazolopyrimidine, and unexpected yield was generated 21%. So I spent a bit of time figuring out that that was caused by the very high impurity of the starting material. It was 73% of impurity was not soluble in CDCl3, and that's why when initially when I took the NMR, it showed it was very pure. Right. So I will scale it up a bit and reproduce this reaction this week. So hopefully we'll get more of the material.
And then attach the other bit. So there's then one more step, and then we have the compound that we can ship to people.
Yeah. Right. It's a so yeah. So the next step was to attach this hydroxylamine to the other chlorine, and hopefully we could get this. Right, and here's a plan. I tried another route for the previous 5-member core, which the desired product is the main product is what we desired. So hopefully this one will work as well.
Yeah, so a bit of a surprise that this material at the beginning was giving bad yields, because actually most of it is not what it says it is. So it took a little bit of time to figure out what was going on, but this has now been made, and so that one more coupling. So the idea is then that we can ship that out to people, and you know, it should be active based on what we know, and if we can generate inhibition data for a couple of the Mur Ligases, and then if we can get structures with this bound, then we will have our evidence of multi-targeting.
How pure is that likely to be?
How pure is this likely to be? Well, when it's made, it'll be completely pure. It's just the starting material had stuff in it that we had to get rid of. So 3/4 of the sample was useless and had to be gotten rid of. And then once it was pure, it works okay. This yield is because the sample wasn't pure, but the actual material is fine.
Okay. There's no carry through.
No, it's actually a beautiful separation based on what's soluble in CHCl3. So it's a solubility purification, which is actually quite convenient. But presumably the reason why the supplier didn't spot it is because they checked the quality of the material by trying an NMR in the standard solvent CDCl3, and so it's beautifully pure, but actually it's not.
So can you get a refund or get them to synthesize more?
Yeah, we'll have that conversation.
Yeah, there should be multiple vendors for this. I'm kind of surprised by Koekemoer. I think usually they're a pretty reliable vendor.
Yeah.
I think, as I recall, it was relatively inexpensive, so I don't know whether it's worth sourcing it from another vendor just as well. I mean, to go through all this purification stuff, that's just really work that shouldn't have to happen.
Oh yeah. Well, it's funny. I mean, once you get to 72% impurity, it's not really an impurity anymore, is it? It's more. Yeah. Anyway, things that are simple are never simple. So yeah, great. All right, thank you, Yuhang. That's great.
Thanks.
So looking pretty promising for getting that molecule. All right, and then next item was us to chivvy the MTA3 atomized compounds. So we are now clear to ship compounds to Diamond, and we are apparently very close to being able to ship compounds to Warwick. I'm told, and so the question is, what should we do? So Dana, I don't know if you wanted to take up this conversation about what we need to ship to where, because there's an issue about whether we should just be shipping maybe directly to Warwick and at one concentration. Do you want to speak about that?
Sure. Yeah. I mean, I sort of volunteered to be the one to create the stock solution. So I just need to know at what concentration. I think for when we sent compounds to you, Lizbe, last year, we did it at 100 millimolar. So I can do that again. I can do the same thing with these compounds, and then I just need to know where to ship it. Does that sound, workable, or is that fine?
Well, I'm fine with 100 millimolar if Becca's fine deleting down for herself from there. Miss Becca.
Yeah, we're fine. It's easier for us to dilute down. So
Okay, so then I think, is it easier to just send it all to Lizbe first? You get what you need and then send it on to Becca?
Yeah, with Laura being the courier in the middle.
Okay.
Yeah, I mean, that was the
that's
issue.
fine. That's
if
fine.
Laura was going to be the one actually doing the experiments, we were wondering whether it made sense to ship to Warwick everything, and then for the samples to make their way from Warwick to Diamond, or didn't know.
As to them, I don't mind. I don't mind bringing them to Diamond. That's fine.
Okay.
If that makes it easier, then it's
Okay, maybe I'll just ship everything to you, Laura, and then you can distribute it as needed. Is that fine? Okay, great.
And this is in DMSO, and we have about 3 milligrams of each. So the question is, do we just send everything, or should we keep some back for some reason in case we need it later? Do you think you'll go through 3 megs? Should we just send it all, or?
I don't think
we will.
Will we?
I don't know.
I think if we get something that hits, we might try a bit of microbiology.
Yeah, maybe for the first screens, we won't go through the 3, but if we have to follow up, we will. Yeah. So we could request another shipment with hits or something like that.
Well, we can always get compounds remade if they're looking good. So
yeah,
no problem. But I mean, but what I wondered is whether we should. So if we dilute everything up in DMSO at the right concentration, should we just send the whole thing, or should we keep back a milligram for some reason? I don't know. I don't know what we do with them here, but is there any sense in keeping some of it solid, or should we just dilute the whole thing? Because you can always make use of DMSO solutions.
Assuming
so Dana, what do you have in terms of robotics at UCL?
0. I'm doing it.
Yeah, so there's 80 or some samples, right? Or 90 samples?
Yeah, I mean, from my end, it's definitely easier to just dilute it all at a single concentration and send it to you guys in vials rather than attempting to plate it out or anything like that.
I'm just wondering if someone had, in terms of the robotics and just making up these stock solutions, if there's a place that's better suited to do that, because that's a hell of a lot of work.
I don't know if Diamond will have it. I don't know, but we don't.
No, we don't. We just normally make it up with ourselves and put it in the
plate. So it's gonna be for everyone.
as soon as it's in an anti-6-well plate, we're happy. Then it's easy. It's getting it there.
Right, but then you're gonna have to. I mean, 3 megs, and I mean, I've never done this, but 3 megs is actually quite a bit of material. And if you're making up 100 millimolar, I guess I don't know how much, how many microliters or how many.
No, that can be very little. That can be up to between 20 and 100 microliters. It's very little, depending on how big those vials are. They send it in. So the easiest is
not how much you make, but the total volume ultimately to get 100 millimolar of 3 megs.
It's little. It's very little.
Okay. All right. Thanks, Lizbe.
So my suggestion would be just make up the whole 3 megs, send it, and we'll put it in a plate and store it as is. Because Diamond, we're at least good at storing it. It's in under nitrogen. It's fine. It should keep.
Okay. Yes, I'm happy with that. So sorry, then actually I'll be sending to Lizbe first or still Laura, sorry.
It doesn't actually matter. Lizbe and
Doesn't matter,
Laura
okay.
is the same person in this one.
Yeah,
Okay, great, that works.
yeah, that's fine.
But who's gonna create who's creating the plates for Warwick out of those?
Okay, so how many compounds is that, Dana?
We're talking about 80 to 90 compounds.
Yeah, it's 90 something.
All right, it's quite a bit.
Yeah.
But I don't know, I offer myself to do it if necessary. I can do it
Right.
here before,
Well,
give
we
it
can just
to
we
people.
can also decide if we want to echo it, and then we can do it at Diamond.
Yeah, that makes sense.
Well, that's what I was thinking.
Yeah.
I mean, I thought the Diamond would have some robotics that would make
Yeah,
this
no.
life
So,
easier
okay.
for.
So to make this easy, it is better for us if it's shipped to Laura, because Laura is at Warwick and can receive the parcel, where I'm not at Diamond, so I can't receive the parcel. So we will know if it's shipped to Laura that she's got it and it's fine, and then she can just bring it to Diamond when she has to come through.
Okay,
So that makes it logistically a bit easier, that we can track the parcel better.
Yeah,
okay, so what I'll do is I still have to QC them. I'll just spot check like 3 samples. And then before I ship, I'll just connect with you guys over email and confirm the plan for what we're doing.
Yeah.
Okay, great.
good.
Great.
And to be honest, if they came here before we had it signed off at Warwick, Laura doesn't need to open the parcel. She can just be a courier to courier down to Diamond. So I don't think we need to hang around.
Yeah, exactly. I can just,
If we're not actually opening it and using it here, then it's not actually come to Warwick. We're just intermediates.
yeah, I can make a trip, that's fine.
Philosophically interesting conversation, Chris. Yeah. What counts?
So Laura is the compound mule.
They're very precious.
Okay, great. I'm gonna get rid of that actually, because that's done. All right. So Becca, the next thing was on you was about the data from the Lizbe fragment screen and the screen of Dana's elaborated fragments. Did you want to update us on anything that's come up there?
Yeah, sure. So the initial fragment screen data from Lizbe's is now on the page under Lizbe's data, where she talked about the compounds and where they came from. So that's now available for everyone to look at if they want to. And I'm in the middle of running the assays and actually looking at the data from Dana's compounds. So I just sent some off to her yesterday to just show her where we're at. It's looking quite good. We've got a few which look like they may be hitting. Obviously, we'll have to check that they're true positives once we've done the full initial screen, but it is looking good at the moment, which is nice.
Do you have a feel, Becca, for what percent inhibition you might be getting?
Some of them are down at only like 10% activity of the full MD, so they're hitting quite nicely.
Woohoo.
Ooh.
Wow. Okay, great. Okay, well, we'll wait with bated breath. That's really a good sign.
Are you going to have a go with an alternative ligase as well with those?
We can do, definitely. We have other Mur Ligases here. We could try any which seem to be hitting quite well. We can try against other Mur Ligases. The assay's quite interchangeable for different ones. So
I would be tempted to do that. Just take the top 5 or whatever, and then just try them against alternative ligases. That would be fabulous. Good job. Well done, Becca.
It'd be interesting to see any prioritization of the compounds, especially the ones that we're getting in crystallography based on the biological data. I think that would make our job a lot easier, or I guess more likely to succeed. Is it the right term?
You mean any compounds that are hitting should go into crystallography? Is that what you were saying?
Well, so we could prioritize them, because I think that what Joe's given us has been very kind and generous, but I think the experimental data is to go into experiments. I think that I would prefer that, if at all possible, or use the modeling data together with the experimental data to sort of decide on what to prioritize.
Right. but I want to make sure we're talking about the right data set here. So there were 3 data sets. Whether there was Lizbe's fragment screen, there's Dana's elaborated fragments, and then there's the enamine set from Joe. Are those 3 separate things?
Maybe, but I'm just saying if we have experimental data on any of the compounds that are going to crystallography, I'd welcome that.
Got it. I understood. Yeah, great.
Yeah, we can.
Okay.
Yeah, there are 4 data sets actually. So what Peter will talk about is a whole separate set of enamine compounds, which is set 4, I guess. Because you have the original Mur E, you have Dana's compounds, you have the atomized compounds, and then now you have this 4th set of enamine things which don't have any experimental data, as Peter said.
Right. Okay. Okay, great, thank you. So next one was Laura, the continued crystallization trials of Mur DME and Warwick with the plan crystals diamond. Is that still?
Yeah. Well, I don't have happy news for you. So we were trying to do the screening on Mur E. coli Mur E, in the presence of magnesium, but the crystals didn't diffract properly. So we did a test on diffraction test and they weren't good. So we need to go back and purify again. I went on holidays right after it. So now I'm gonna get again Mur protein and find out why. We do crystals from different sources, like Lizbe had some crystals done and mine, and they were all really bad. So that needs to be looked at. So I'm looking into it now that I'm back, finally.
Okay, so going back for new protein and new attempts.
Yeah, I'm going to start from scratch again, just in case something went off. And we're starting scratch, everything, including the conditions for the crystallization.
Right. And that's Mur E. coli.
Mur E. coli, Mur D. I need to check the last experiments of crystal plates, but it didn't look that promising when I left. So they will need a bit more optimization on that one.
Okay.
And then, yeah, but if we have any other Murs that need to be looked into doing fragment screenings and all that, let me know. I can set up also plates if needed.
Okay. All right, great, thanks.
And send me any compounds or let me know what are the compounds you want me to do. Yeah, I can include that.
All right, next was the AZ compound shipment for crystallization trials. This was on Joe and Chris and Bart. Any changes there?
Well, I heard from my legal that I submitted the form incorrectly. So I had to resubmit the form. So we'll find out next month if it was submitted correctly, I think.
Okay. Okay.
AZ did get back to us with a agreement that we needed to sign and look at.
All right, so there's still correspondence there.
Yeah.
All right, cool.
I have a horrible feeling inside me that that AZ agreement is still in our legal system.
In your legal?
Yeah, the one that Warwick. So I submitted for access to the compounds as well, not yours, but that would be a nightmare if yours had ended up in ours. But it's bad enough that dealing with their own. Yeah, so I've just been pushing them on the atom-wise compounds, and I think I'm going to push them again today on the AZ. So yeah,
that would be strange, though, wouldn't it? If legal documents could migrate between legal departments, that would just be the end, I think.
You know, this is such a thing, isn't it? We talked about it last time when we met about having a framework agreement where we can just get all this done, because it's just
yeah. All right, we applied for the Antibiotics Research UK funding on the 28th. So we ended up in a scramble at the end. We ended up putting in a proposal for about 50K to drive the chemistry to get compounds made. with the understanding that those would then go to Warwick and Oxford / Diamond, who were the co-applicants. So we put that proposal in, which is good, and they've received it, so we're waiting to hear. We also on the same day put in this submission to the European Lead Factory call. They've come back to us for some clarification on our experience to date with the assay that we mentioned in the proposal. And I think that's with Chris D and his team to come up with some comments about how the assay goes so that they can judge, I guess, how easy it is going to be to run themselves. Is that your understanding, Chris?
Yes, I think actually what they want is they want some validation data for an assay we've not yet developed. So at the moment, the assay is in the one assay that Becky uses is in absorbance mode, and we can't run a high throughput assay in absorbance mode because you need to get everything needs to crank down volume wise. So it needs to be a fluorescent mode. So there's a coupled system that we've used on several other high throughput screens. We know it works fine. And we know it will work, but they want us to run it and give them some data. So I think what I'll give them is a holding email saying, you know, they're not going to be deciding until, when is it going to be? Their decision date is not for a few months.
Mm-hmm.
Anyway, so as long as I can just keep it in the system, that'll give us a few months to actually go and do the high throughput validation experiments. And we'll need to have a chat locally as to who's actually going to go and do that. But
right. Okay.
We will get that sorted, so that's not a hindrance.
Yeah. Okay. I mean, it was good to know that the terms of the screens are not completely problematic in the sense that there is a period between doing the assay and releasing the data where there's a negotiation period between the partners of the ELF and the people who are behind the screen. But once that has completed, and on the assumption that none of the partners in the ELF want to develop the molecules that have been identified on that assumption, given that it's antibiotics, is a pretty good assumption, then we're free to do what we want. We can deposit the data in the public domain and we're free to go. So if we were all happy with the idea of a short delay, which I think was a couple of months, right, between the data being generated and being released publicly, then there's no conflict between the two, between ELF and what we're trying to do. Mm-hmm. Secondly, that there has never been a screen against Mur Ligase. So it was a good conversation. Okay, so we wait and hear. Jan Jensen's not with us, but I'll leave that thing up for him to have a look at. And then Peter continued crystallization of EG with Mercy with enamine compounds done by Joe. All right. So Peter, did you have anything you wanted to comment about this?
So we didn't see any density for the initial set and the Mercies. And so the compounds, it would be really good to know, you know, if us using more crystals and soaking them, if it's going to be helpful. We're happy to soak them. That's not a problem. I just don't know, you know, if we could have any kind of affinity information, I think that would be super useful. At least on the concentrations to use, and you know, sort of give us a little bit of a handle on how to get saturation. And then the second thing is about the MURDs as well, is that we have crystals in diffraction, but we can't solve the structure because the protein is crystallizing in a peculiar way. So if we could modify that at all with the compound, that would be very, very useful, but we just don't know which is the ones to prioritize because this can really mushroom into enough experiments where we could run out of protein. So in the interest of not just sort of going hog wild, it would be really good to sort of get a little bit more guidance on which compounds to focus on, because the 4 that Joe has provided is the higher priority one from the list. I think that's if you could get down to 2, I think that would be more realistic and sort of understanding whether we're going to be able to get something on a short order.
Yeah, I mean, this is, you know, Peter, you know, this is obviously we kind of gave you a very Herculean effort here because none of these compounds have biological data. So this was all just, you know, a virtual screen trying to pick some compounds out. So it definitely was a very high risk endeavor. So, and I definitely hear your concern about, not just burning up, valuable protein trying to do a bunch of trials. So I'm not sure. I mean, one of the things we could do would be to, in theory, I guess, order the compounds again from Enamine and have them shipped to Warwick. Excuse me, shipped to Warwick and see if they. And I've forgotten exactly which, because right now they're running Mur. These really weren't tested against, weren't really docked against Mur. I think these were. I looked at these more Mur C, Mur D, which right now I guess Warwick doesn't really have assays for those, if I understand correctly. You don't have an ongoing biochemical assay for Pseudomonas or Acinetobacter. Pardon?
C and D, yeah. Mur C and Mur D.
C&D, basically what Peter's been going against is both Pseudomonas and Acinetobacter, Mur C and D. So I guess go ahead.
So all we would need is protein, Joe.
Yeah.
I mean, the assay.
Right. Well, I think that's an action item that you guys have had to work with the SSGCID because they have those proteins that they are willing to ship to you. So that's just a matter of you guys
Protein
acting on that action item.
Protein or the vector, and I can make the protein.
Again, this was.
Yeah,
been discussed for several months about, and Bart has made that offer to provide the protein. Yeah. So just kind of have to close the loop there.
Maybe I can work with Laura to show them how to use. We have a website interface shopping cart where people can order the proteins, and we do ask that you pay for the dry ice to ship it because we don't have a dry ice budget. But besides that, whatever we have, we're willing to ship to people.
Okay.
I mean, we can't run, all of the protein assays all the time. So Becca's got, the assay running for these compounds. So she's, 100% occupied on that. So actually we're rate limited on numbers of hands for the assays. So we're not rate limited on which proteins we can assay. It's pairs of hands to assay them. So that's something we do need to think through as we're starting to ramp up on this matrix, actually.
Yeah, that makes sense. I mean, really, what I'm trying to probe is whether or not there is any room for someone else to do this. So what we can do is we can do like a biophysical assay, like a DSF, and see if we can't see any kind of thermal stabilization by the compound. So, I was just trying to sort of see what we can utilize here for the team. So let us maybe pause on the crystallization, see if we can do any DSF, and then come back, and maybe in a month's time we'll have data to share in a orthogonal assay that could potentially not utilize too much protein but still have some sort of a feedback on any prioritization that we can establish. Or we welcome your ideas on what we could do. But anyway, just I was
gonna suggest that, or SPR if you have, so you lose less protein.
We do have SPR, but I'm just not sure if the histag protein is really the right method of immobilization. So I think the DSF is a little bit easier, uses less protein. Yeah. So, but I welcome your thoughts.
How big are the compounds?
They're pretty small, right, Joe? I think that they're in 300-400, 500 molecular weight. You're on mute.
Yeah, I think these are kind of in the 300 to 400 molecular weight. They're relatively small.
Yeah, because they might not give enough shift. That's the only. They're on the H, isn't it?
Exactly. Yeah. So that's why I figured we'll try. We'll come back, but we're gonna see what we can do with the crystals we have in hand. But we're not gonna set up any more trays because I don't want to blow through all the protein without the right set of data first. So anyway. That's where we are, but we'll get back to you in a month. And like I said, DSF is the next thing if you want to put something on the action item.
That'd be really helpful, Peter, just to go through with Laura about ordering the proteins, and then Laura and I'll have a chat, and then we'll circulate our thoughts on what to order with everybody else, so that everyone's in the loop. But yeah, more proteins would be good, both for structural stuff and for assays. So we can just, as we're working up the different assays, we just plug in the different proteins and just be sure they behave as expected, but they don't always, Becca, do they? So we just need to, you know, tweak them occasionally.
Yeah, makes sense. I think Bart is the ordering expert, so I'll
Right.
defer to him for the shot. I don't know what to do with that either.
Yeah, Peter, I'm pretty sure you can guess what I want to do with your protein that's with your bad crystal form. So we should probably so we can make, you know, all the surface mutants we want to for that one, and that would be something we could do over on our side. So we should meet to plan those, I think.
Sounds good, Bart. I'm always happy to meet with you.
All right.
One thing that's going through our head, and something that Becca has asked me, is whether you guys could co-express proteins, like do a pet duet co-expression of D and E, because it might be handy to know, because these things do lock up next to each other in reality in the cell, and what a dual structure looks like in case there's any major changes.
Co-expression of which one?
D and E.
D and E. Yeah, we have series of p-duet vectors that we've used before. We haven't tried co-expression.
Because one of the other things is that one of the experiments we haven't tried to try and explain why there are not clinical inhibitors is how these things work when the Mur ligases are in complex with each other. And we've been, thinking about substrate tunneling and such like, and local concentrations of substrate. And we're looking at doing assays with multiple enzymes present and seeing how inhibitors work in the presence of either a single enzyme or a complex as well. So starting to think about multiple enzymes working together at some point soon would be good, particularly if we're dually targeting these things. How do those enzymes still inhibit when you've got both enzymes present at the same time?
Right. Yeah, we should consider doing that. That's something that in our lab we'll be shorthanded to do, because we don't have the way that we operate is we do like high throughput sets, which we have space to do things for, but we don't have low throughput hands to do side projects because those are all doing COVID stuff basically. So that would take more time for us to do, but it could be a project that we consider doing, I think. And I don't recall where we're at with Mur E. Like, I know we have Mur D expression, but I don't know if we have decent Mur E expression. I'd have to take a look.
Yeah, and then also multiple Mur E's. Obviously, if we're going for a DE inhibitor, then we'll need multiple Mur E's. So we'll as Joe said, we'll close the loop. Let's say by the end of the week, and send a list of requests either through the website or through whatever special route we need for a low throughput option request.
Yeah, that makes sense. I mean, the reason I think it would be good for us to eventually get some biological data is because none of the Mur Cs and Mur Ds that we're working with are full length. They're all truncations of some sort because the full length proteins just do not crystallize.
Yeah.
And so I think that, it would be eventually good to understand whether or not these inhibitors that we have structures of, if they behave the same way or they have the same, I don't know, SAR as they do in the mutants. So I think it would be just good to, or whether or not the mutants that we're working with are active. So I think it's all sort of good to close that loop as well.
Yeah. So full length constructs that could be expressed but maybe not crystallized, that would be good biologically for us.
That's right. Yeah, that's
Yeah. Good. Okay. Well, we'll get that list together and circulate for everyone's input. Laura, Becca, we ought to chat this week. Get that sorted this week.
Good.
Yeah. So I mean, just Peter, the two compounds you solved from Intersys AZ, against Mur C, I mean, those were low nanomolar. I mean, basically 1 nanomolar compounds, I think, against Pseudomonas C. So, what are the dynamics? I mean, I know there's some issues in Mur D, for example, with dynamics of the protein. So yeah, these compounds, I'm sure, my guess would be these are really more almost like XChem fragments. I assume they were probably the potency would be at best 10 to 50 micromolar would probably be, would be, optimistic maybe for some of those fragments would be my guess. And so what was the concentration? I assume you were screening these at probably at 110 millimolar, or in terms of when
Yeah, I mean, we try to go high concentration. We try to go high concentration, but it's,
so that was like millimolar
usually,
actually.
Yeah. That request was for 5 millimolar. I didn't get any notes that they would fall out of solution, but
Right,
we are
right.
aware that there's always that magic compound behavior where it's the KD or the IC50 is the solubility. So
Right,
it's
right.
yeah, and then how do we get to the saturation? And it's the only way that we can see it in a crystal structure is if it has high enough occupancy. So just without getting too far into the weeds, I think that it would be good for us to understand which ones are the ones that are the most potent, so we can start with those, because I think most interesting and most potent are not always aligned. And yeah, just getting some of this information, I think it's like I said, I want to make sure that I give you information, not just tell you that we're done with the protein and good luck.
Right. Well, I think hopefully Yuhang will be able to complete out the synthesis of that one AZ compound. I mean,
Sure.
I think that's our best shot on goal here in terms of ultimately getting crystal, because those are more profiled, and get the biochemistry on those, and then hopefully a crystal structure, and for example, Mur D or Mur E. I think that's the shortest path to proof of concept for dual inhibition. No pressure, Yuhang.
Sure.
Just let you know.
Yeah, sure.
I mean, crystallization can be a purification method, so even for the compound. So if you have something that you think is potent, that has the potent compounds in it, and the isomers are not going to interfere, then, or whatever the byproduct is not going to interfere with binding, that we could always try that. But as a drug development, I think that it's always good to have a second series or multiple series. And so if that's the goal with the different data sets, I think it would be good for us to get biological data on those, because if you already have a lead compound, that's one thing, we can get a structure with it. But whether or not you can get the structural information on the backups in the assay, or I think that would be project enabling, at least in my understanding, but I'm definitely not in the forefront.
Definitely for grant writing, having two series is not essential, but sure helps.
Just on the co-crystallization thing, Chris, I'm assuming that if you want to get a structure that mimics what's happening in the cell, that then truncated protein is not the best. If you're wanting to see the association between the proteins, is that right?
Might be the only choice we have there.
I mean,
For structure is the only choice, yeah.
Okay, thanks for that. There's a bunch of little minor things here, which I think you can all see on the screen, about our interactions with AlphaFold and David Baker Lab, and whether or not we could soak some of these comments at Diamond, which I guess is a little academic given what we were just talking about, and the possibility of a biochemical screen against another non-ATP site. I mean, I'm going to leave those there because I don't even need to go through them unless anyone would like to go to speak to any of these now. We can leave them there, and they can be going along in the background.
Matt, I sent you some options for the AlphaFold proteins.
Oh, is that on me? Sorry.
Yeah, I sent you kind of Mur. I think Laura chose options of a Mur C D&E with a crystal structure and one that was not crystallized. And then I also sent you a tRNA synthetase as well. Or two.
Right, I'll find that and I'll dig it out and we can progress that.
But yeah, I think that just needs agreement from folk and then sending on to them. Because
Okay.
they were keen to just have a bit of pilot work with a handful to see whether they could get it to work.
Yeah, okay, yeah. All right, great. That was everything we had from the meeting. Is there anything else we haven't talked about that anyone wants to raise?
I'm sorry, Becca, I can't seem to locate your file that you said you uploaded. Could you send out a link? There's I guess various different pathways in GitHub, but if you could send out the link of where you actually uploaded that data for the fragments that you just generated % inhibition on, that would be great. We appreciate it.
Yeah, I'll do that straight after the meeting.
Okay, thank you so much.
Anything else from anybody? I think we're progressing on all fronts, slowly but surely. All right, great. Well, thank you so much for your time. I slated Tuesday, July 6th, 2 p.m. for our next catch up. If that works for everybody and there's no, I haven't forgotten something like the Queen's birthday or something like that, then I can send a link out and we can all meet up.
Sure. Very good.
Great. Thanks so much, everybody. Nice to see everybody, and see you next time.
Thanks.
Hey guys.
Bye-bye.
Thanks. Bye, everyone.
Bye.
Everyone.